happy Tuesday to you once again. We are filming from our studios from Istanbul, Turkey, and I'm so excited to have you here again. So today we're going to be talking about something really exciting. Yes, it is exciting. On this show, we've talked about mental health, social health, and even spiritual health. But we've never talked about physical health because we've been trying to outsource for the right person to give us the right information. And trust me, today we have that amazing person in the studios with me. So join me as we welcome Dr. Marthilda.
Great. Thank you for having me.
Welcome. How are you feeling today?
I'm feeling good.
Good.
I
All
would
right.
say, yeah.
So before we go on, guys, guess what? Good news. We are not only on Facebook now, we are also on Instagram and YouTube. And our names, our handles are Youth Arise Chatline, both on Instagram and on YouTube. So all my Instagram family, guys, go there, join us live, comment, share with your friends. It's way easier now, I know. So start sharing. So guys, did you notice what happened yesterday on Instagram, WhatsApp, and Facebook? How did you feel, Dr. Marthilda?
I think at first I kind of maybe panicked because
Okay.
I was not getting my messages.
Okay.
And then after a while, I reached out to some people and they said, oh, they're also affected. And when you reached out to people in Nigeria, they were like, oh, we too, we have the same problem.
So you relaxed about
Yes,
it?
I relaxed. I
Yeah,
went to
same
bed.
here. Immediately I knew it was a worldwide problem. I slept. I went to sleep.
Exactly.
Like, Mark will sort it out in the morning, and he did sort it out in the
True.
morning. So shout out to all the IT gurus in the world for helping us. Unless how will we stream this beautiful show to you today?
Exactly.
So like I said, we're going to be talking about the physical health today, COVID-19, and all sorts of illnesses, and all the information you need to know about your physical health today. And we have Dr. Marthilda here to give us all the scoop and tea on our health. Okay, so Dr. Marthilda, please share a snippet of your journey. Okay, let me introduce her properly. She's a practicing doctor practicing Nigerian doctor. That's huge. If you don't know, in Istanbul, Turkey, this is amazing for us. So she's a practicing Nigerian doctor here in Istanbul, Turkey. So I'd like her to share her journey with us. How did you become Dr. Marthilda? Your name is strong. So
yeah. Okay, in a nutshell, I think I came from Nigeria in 2009. Yes, so I studied Turkish language first, which was a requirement. So I did that for like a year plus, thereabout. And then from there I moved to Istanbul, because at first I was in Ankara for the language, and then I moved to Istanbul, and that's where we began the medical training. I graduated from Marmara University. I don't know if so many people have heard of it, but it's one of the prestigious
it's
medical.
very popular and very difficult to get into.
Very difficult to get into, very difficult to graduate from, as well as a state school. So it's quite a revered school, and the medical faculty is one of the good ones, I would say.
It's like a holy grail.
Yes, so yeah, I did that, and then I graduated in 2019. And then from then I've been practicing.
Wow, that's a journey.
Yes.
2009, 2009.
Yes, I had a few hiccups, but yeah, I'm here today.
You didn't stop?
No, I kept going.
You see why I said we outsource the best. Guys, you need to pay. Start paying on Instagram for this show. All right, thank you so much. So what are the challenges you faced being a black doctor?
Oh, okay.
Or from being a black medical student, just a few of the... We know there's a lot, we know.
Yes, there's a lot.
But just a few.
I would say the one that stood out the most is just the fact that you look different already. So when you're in a class, you have to always prove yourself. Yeah. You are under so much pressure. And it might not really be from society. It's more of like your internal pressure. You're like, okay, I do not want to disappoint, and I want to be an ambassador from where I'm coming from. You don't want people to think...
You just take the cap by yourself.
Yes, you don't want people to think, oh, Nigerians are not good at anything, and you want to prove yourself. Or let's say Africans, because they don't know countries here. They don't know the difference. They're just like, oh, you're black, you're African. So there's that internal pressure to always do well. So that alone can be crippling to your mental health. So that was like one of the challenges I faced, because Like, let's face it, at the time, I think I was the only black person. I was even the only foreigner in my set before some other people transferred from other from other countries. Sorry. So it went on like that for a while, and people always trying to pick on you for one reason or the other. They always try to find faults, something you didn't do well. So I think that was one of the biggest.
So what about being a doctor now? What challenges do you face?
Being a doctor now, the challenge I face is getting patients to trust me. I'm not talking about people that look like me. I mean, like
the white people.
The white people, Turkish people. So getting them to trust you is one of your challenges here when you're a black doctor. But actually, when they come a few times and they see they are getting better when you attend to them and you prescribe your drugs and you take care of them, then they are like, oh, she actually knows what she's doing.
Wow, that's a journey. Like, it doesn't stop, right?
No, it doesn't stop. It's just the beginning.
We are so proud of you.
Thank you.
Okay, so seeing that as a doctor you face these challenges, what are some of the challenges black people face when trying to access medical help in Turkey?
Okay, first of all, we all know it's not an English-speaking country, so that's the first challenge. You go into the hospital and nobody seems to understand what you're saying, so you cannot explain your symptoms properly. You cannot tell them exactly how you feel. Like, you tell them something and they understand something else. That's the first problem you have. So if you cannot communicate what is exactly is wrong with you, then you cannot really get the help that you're there for. So I think that is the major challenge that people are having here.
So do you think on the part of the black people we should learn the language, or do you think the community where we live in should be more receptive? What do you think?
I think it takes two to tango. I think both people need to make effort. The Nigerians, or would I say Africans here, they need to try to learn the language. At least, I don't mean learn it perfectly. I mean, like, learn it to the point that you can express yourself in a way that you'll be understood. And the hospitals, they can do better. Like, they can actually have an interpreter waiting at the entrance everywhere, if possible. Even if you cannot say, okay, all of them should get educated, all of them should learn English. That would be tedious, but at least get someone, when people are coming into the hospital, they will be able to explain what exactly is their problem and what they need.
Wow, thank you so much. Thank you so much.
Yes.
So we heard something from you, and I myself was the first time I was hearing that, and that was from you. You talked about the free medical care foreigners can get here in Istanbul, Turkey.
Yes.
So please, could you tell people, not everybody was in church, okay? So could you tell people online about this? How can they access free medical health care in Turkey?
Okay, first of all, you need to get registered. So when I mean registered, you need to get registered to a family health center. So where I work is a family health center, and all the services are free. But you need to get registered to access this free medical. Yes. So what I actually said in church was, mine is available. I can take as many patients as possible. Because I also speak English, it will be an advantage to anybody that will come. Because you can go to a Turkish doctor who is also a family health physician, and he or she would not be able to help you. So
even if he's willing to.
Yes. Wow. So that challenge, I'm taking out that challenge that we talked about earlier.
Making a difference.
And I make it, exactly.
So where can we locate this family health center?
Okay, it's here in SNU actually. It's just that it's in, we call it Mahale in their language. It's in accent Sedin Mahale C.
All right.
And it's easy to find on Google, but for one reason or the other, I don't know why some people...
I didn't even know you can get free medical health care in Turkey.
Oh, really?
No, I didn't know. Oh. I always used to complain that what kind of country is this?
No, you can.
Wow. Guys, we're not just giving you tea, we're giving you life-saving information, guys. Thank you so much. Okay, so let's move on to the trending topic in the health industry, COVID-19. It has refused to go.
It has.
It's acting like it's here to stay, and apparently people are trying to adjust to it.
Yes.
But do you feel we're adjusting fine, or we are becoming complacent?
Okay. I think at first everyone was scared
Yeah.
and they were being very careful. But you know how it is in life. After a while,
You
we all
used
get
to
comfortable
it. Yeah.
and we feel okay, nothing's happening anymore. Of course, I think we are getting complacent.
Okay.
Everyone is getting relaxed. But you should not just be relaxed without taking precautions. You should not forget that this thing is still out here and actually it's still killing people. So there's no room for being relaxed.
So guys, it's still here. Don't
still
act
here.
like it's not here. So okay, to the solution, the vaccine.
Yes.
So especially black people, I didn't want to take it. I feel like I was forced to take it because they said if you don't take it, you can't come to work.
True.
So can you enlighten us? Is this vaccine safe?
Okay. Now, is this vaccine safe? If you'd ask these questions to even the people who worked on the vaccine, they cannot give you a
Because there's a
100%
clause. Sorry to
guarantee.
interrupt you. There's a
Yes.
clause when I went to sign the agreement.
Yes.
There's a clause that said short-term basis, nothing is going to happen to you.
Yes.
But in the future,
Yes.
and I held my pen like this. I was like,
But the thing is this though, when we were all growing up, our parents took us to get vaccines, right?
yes.
And those vaccines, some of them also have side effects. Some people actually got the side effects from those vaccines. So with every vaccine you take, there's always a side effect. The reason why this one seems very scary is just because it seemed like they rushed it and they worked on it too fast. But actually, that's how it is in a pandemic. The last time they had a pandemic was when they had the Spanish flu, which is now known as influenza. And influenza, every year, everybody is advised to get their flu shots. People still get their flu shots, actually. But they are not scared of that, and I wonder why. It also has a side effect. It's just like the COVID vaccine, and people get them every year. Because I remember someone was saying they heard they are going to have to take this COVID vaccine every year. And I said...
because there's I heard.
And I said...
After the 2 shots, you take another one.
Yeah, and I said, but you take flu vaccine every year, but you don't complain about that. So what is the difference? I think the difference is the COVID vaccine, there are so many things outside about it, making people scared. And
so many conspiracy theories.
Yes, and the most interesting part is some people will take other vaccines but are scared of COVID vaccine.
Yeah.
But some other vaccines have the side effects. And then someone told me, oh, but other vaccines, when you take them, you don't develop the disease. And I said, no vaccine is 100%.
Because it contains the virus.
I got the measles vaccine when I was young, but I still came down with measles. It didn't fully protect me. It only protected me enough not to go to the hospital. So what this vaccine does for you is you do not get to go to the hospital. You do not get to take up a bed. You know, when people are sick, then some of them progress to ICU. They call it intensive care unit. So it gets that bad, they need to be there. But with the vaccine, you do not have that you don't go there.
It doesn't get to that point.
So that's what vaccines are made for you to get to that point.
I think I'll take my second dose now.
Okay.
I haven't taken my second dose.
Okay, you should.
Yeah, I will take now. So you heard it, guys. She's not saying it's not safe, it's safe, but think about it. What do you have to lose? All right? Because you already taken vaccines before now. And yeah, so that answers it. Please take your vaccines, guys. Let's all be safe out here. Okay, so we live in Istanbul, Turkey, if you don't know, where so many young people reside, and a lot of them indulge themselves in some practices that are not just illegal, not just not Christian worthy, but also can harm their health. So can you shed more light on some of the activities you feel that most young people in Istanbul, Turkey especially, actually indulge in that poses a very high effect on their health, both consciously and unconsciously?
Okay, I think first of all, the most common one here has to be, I think they call it nargile, the shisha.
Oh yes. Ooh.
So it looks recreational.
Yeah, and it smells so nice.
And it looks fun, and they have different flavors. you know. But the thing is, all that is used to mask the actual tobacco and all the chemical reactions going on inside the nargile. So it's like tobacco over a water pipe, actually. So I don't want to bore you with the chemistry of it all, but it actually is more toxic than a cigarette. One cigarette, one round of shisha is actually more toxic than a cigarette. So that's what young people do not know. So another thing is, you share the shisha with people.
Yeah.
Now, there's a risk of getting hepatitis A, B, and even tuberculosis when you smoke shisha, because you're sharing with people and somebody might...
Guys, one shisha is not up to 100 TL, and are you hearing all the things that come with it?
You can get so many things from just engaging in that. You don't know what the next person has, and you guys can just share so many things, and then you go home thinking you're fine.
Wow.
So that's actually bad. And then the cigarette itself, of course, it's even there on the packet. It says, smokers can die.
I will never really understand the smoking, because with the shisha I get the effort to mask it.
Yes.
So you can say, oh, I wasn't really informed. With the cigarette, the smell is bad. On the pack you get to see something that is really like scary, and people still buy.
But that's because in cigarette you have nicotine, and nicotine has some receptors in our brain. So I'm going into the chemical aspect. It has some receptors in your brain. So when you smoke, a person starts to smoke, and at first it's not enjoyable, and then when you smoke another one, those receptors come alive. With time, if you do not smoke, you feel the need to. Those receptors in your brain, they're like starving. You've introduced them to something new that they like, so they want more. So that's why you see them, they graduate from 1 packet, 2 packets a day, 3 packets a day, 4. Some as bad as when they wake up, they have to smoke.
Yeah, they call it wake and bake.
Okay.
Yeah. I've heard that
okay,
one.
I didn't know that.
They wake up, they smoke first, and they start.
Yes. So it gets that bad because of nicotine addiction.
So what can this smoking of both the shisha and what can it cause?
For men, they don't like to hear this, but this is one of the things that happens. It gives men low sperm count. So when they are now ready to have a family, you see many of them, they are unable to get their wife pregnant.
And they make the pastor keep calling the barren women out.
No. So many men have smoked, and it has reduced drastically their sperm count. It's affected their reproductive system. They are unaware. It's affecting their respiratory system, that's their lungs. So, and they are unaware. So if you are unhealthy, you cannot really procreate. Yeah. So this is just one thing, first of all. And of course, later on, lung cancer.
Wow.
So that's terrible. So.
So what about drinking?
Drinking alcohol, wow, that is bad for the liver and kidneys. And so that's why so many people these days are, I don't know if you've heard in Nigeria, like kidney failure is so rampant these days, and it's because of the alcohol consumption.
And I think here in Turkey there's something going on. I don't know how people are informed. There's a lot of fake alcohol being sold right now.
Okay, yeah, I've heard about that. And it's not processed the right way.
Yes.
So the way your body absorbs the alcohol, it's like pure alcohol. So everybody has to be careful out there.
Wow.
Honestly, that's my advice.
Wow. So let's talk about smoking, drinking. So there's this one that I think it became pop to me anyway, personally. Okay. I began to hear a lot this year, upper respiratory tract infections.
Okay. Yes, this is the season for it, actually.
Oh, no wonder.
This is the season for it. Winter time, because Turkey has 4 seasons.
Okay.
You have the winter season, you have the autumn, and then you have
spring and
summer. Yes, exactly. So we transitioned right now from autumn. We're transitioning from autumn to winter. So during these months, there are so many viruses that come alive, and they affect the respiratory system. Upper respiratory system is basically your nose, your throat, and yeah, let me just say your nose and your throat to make it easy. So, like, especially with kids, you see a lot of them, their parents are practically in the hospitals every day right now.
Yeah.
The kids are coming down with flu, what we call flu, because they've started school. So every child is like passing it on to the next child. So some are actually viruses, and these viruses, there are really no cure for them. Your body just has to fight it. So during this time, what you would do, even as an adult, would be to eat more fruits, vegetables. If you can buy supplements, you buy supplements. Then you drink warm fluids as well. Keep yourself hydrated. Even for the kids, the same thing I would advise. But the one thing that I would say that a parent should notice is if the child is running constant fever, and if they notice that outside the child's neck is kind of swollen, then that child will need, even an adult will need a course of antibiotics. So for that, you need to visit the doctor. Please do not self-medicate.
We're going to get to self-medication. But before that, let's read some comments from Facebook.
Okay, sure.
Emmanuel Adaka is saying, it's a privilege having you, Dr. Marthilda, on the show today. Miss Chedi, you got a big fish, oh. Make I sit down, learn, no. Yes, so very big fish. They pay for this kind of people, but we are privileged in the house. Adele K. Bukola is clapping. Thank you so much. Okwemi Odeode is saying, we are here. We'll go to see you, Chedi, and our doctor, Ma. Thank you, Okwemi. Okwemi also said, I have a question about the vaccine. If the second dose is not taken at when due, does it mean that one will have to take the first dose again?
Oh, no, actually, that's not true. If you've taken your first dose is, thank God we are in Turkey. So everything is integrated. We can see everything. If you've taken your first dose, all you need to do is wait for your second dose to the time for your second dose to come. So once that time comes, you take your second dose. If you are unable to take it at the specified time limit, it doesn't matter. Anytime you can, you go and take your second dose. Just for your own health and safety.
Okay, so back to the activities young people indulge in.
Yes.
We also have the I don't want to call it, it's not self-medication, it's still indulging. Yes, I don't want to
recreational drugs.
Yes, you know the codeine.
Yes,
it's rampant here also.
Yes.
Tramadols and the whole. There's a lot of mixtures going on these days.
Yes.
If you go to parties, they actually serve you mixtures. You need to be very careful before you drink what you did not plan to do. So what do you have to say about that?
Well,
and they say it's just codeine.
No, it's not just codeine. Like I said, the way you have nicotine receptors, you also have some receptors in your brain binding to these things. When you abuse these substances, you get yourself addicted. So you get to a point where when you don't get that thing, you cannot do anything else. You can't function. So let me explain it. I don't know if you've heard of withdrawal. Like when someone
withdrawal syndrome.
Yes, when someone is coming off of a drug, they can't get it. So think of this. Let's say they stop the production of codeine. You're going to see the hospital full of these people shaking, yes, vomiting, many of them. Some even go into, it gets as bad as some even go into coma. Like it gets that bad, they need to put them into medically induced comas. So, because the body feels starved. Now it doesn't want food.
Give it every
time. Now it doesn't even want food. It's that thing. It has to be that thing or nothing. So that is the danger of abusing. Yeah, it's codeine. But what if one day there's no more codeine? What are you going to do?
And it's ridiculously expensive.
Then there's the danger of overdose.
Wow.
You can overdose on codeine. You can overdose on tramadol. And what happens is the brain just shuts down.
Wow.
So...
Guys, some of these things we take them like lightly, and it's not. Okay, here on Instagram, hi Instagram fam.
Hello.
Okay, so we have Princess Frederick Josephine is saying Turkish is hard and beg. How did you learn? Because some of us have been here for a while and we've not gotten past Maraba.
I think what actually helped me was for 1 year, it was only Turkish, no English. I went to Tömer, Turkish. They call it Turkish Learning Center.
Okay.
So for 1 year, basically, the only thing I did was Turkish. I wasn't working. I did not have any extracurricular activities I was engaging in. It was only morning to afternoon Turkish lessons. So I would suggest, that will help. And then the other thing would be, try as much as possible to limit English speaking. I know it's hard, or maybe you should reserve that for a later time during the day. Just concentrate on only Turkish. But it's hard when you're here working and doing some other things.
Yeah, true.
Especially if you're an English teacher. I know you do speak English.
Mr. Benjamin too is complaining about Turkish is okay. Benjamin is saying Turkish is not hard, lol. Okay.
Okay.
Mr. Shagun is saying Turkish is chokzor. Chokzor. I don't even.
You say chokzor.
Okay, chokzor. Okay, really very difficult. Yes. Okay, 7 years and still learning. Brother Shagun, we respect you. All right. Brother Shagun is asking a very good question. Thank you so much, sir. Is weed medicinal?
Weed? Okay. When you're taking weed by yourself, call it marijuana, of course. So when you're taking marijuana by yourself, I wouldn't call that medicinal because you don't really know the dosage.
Okay.
So the marijuana that I know is medicinal and it's approved, I think in America, there are some places that a doctor is allowed to prescribe medical marijuana for some situations, like a person going through chemotherapy, which is treatment for cancer, like we know, like somebody having Parkinson's disease, the constant tremor. They are giving them to ease their life. It's not for recreation. But when it's recreational, you are the one packaging it yourself. You don't know the dosage.
The source.
They could mix it up with cocaine or something, and then you could be laced. So, guys, be careful out there.
Guys, be careful out there. Be careful. Don't just join people to do things without reasons. Okay, please ask questions before you actually indulge in things. So, still talking about medications. What about self-medications? Nigerians here have a very funny way of using medication.
Not just Nigerians.
Hello, are you coming from Abuja? Please, can you bring 5 packs of amoxicillin? Why? I don't understand. Because my question to them is, you live in a country where this is regulated for a reason. So why do you feel the need to still import your... Just step in.
Okay. The problem with... You mentioned amoxicillin, right?
Yes.
It's an antibiotic.
Yes.
So the problem with antibiotics is that when you use them by yourself, you are actually doing yourself damage without knowing. Because actually, you could be taking antibiotics for something that does not need antibiotics, first of all. Or you could be taking the wrong antibiotics at that time for something that needs a different antibiotic. So you should not just take antibiotics like that, because what happens is, if you take the wrong antibiotic for a different disease that you're not supposed to, by the time we are giving you the right one, you may have developed resistance. And resistance is when we are giving you drugs and the drugs cannot help you. So that is one of the leading cause of death in some communities. Like, you're treating an infection and the infection refuses to go. Why? Because the person has
activated the antibiotic resistance.
Yes, the person has previously abused other drugs. So now we don't know how to help.
Wow.
Yes. So that's why you shouldn't self-medicate. Maybe you don't even need antibiotics.
You know, the one that I think I want us to talk about this, and okay, someone said, I'll read this comment. I do. Okay. Someone said, Princess Reddick Josephine said, I do that too, especially for malaria. So now we live in Turkey. Let me keep quiet. Is there malaria in Turkey?
There is malaria in Turkey, but not really in Istanbul.
Okay.
Because they always take care of mosquitoes here. Okay. And the types of mosquitoes they have do not really carry malaria.
It's not the Anopheles.
It's not Anopheles.
Because I have this problem with people when they say, I'm taking Amatem. I'll be like, why?
No.
I have malaria. I'm like, in Istanbul.
Not in Istanbul. They have malaria, and it's a different type. And it's found in the eastern parts of Turkey, those remote areas, the villages.
Guys, information.
Yes.
So you're just popping pills into your system for no reason.
For no reason. The person is probably just having flu or
fever or something.
Or fever or something is going on that they need to get checked out. It has nothing to do with the antibiotics.
Guys, please.
And you can't even take antibiotics for malaria, actually. You need anti-malaria drugs for malaria.
I've heard all sorts actually in this country.
Yes, thank God we are addressing that right
Please,
now.
guys, please, you've heard there's no malaria in Istanbul. Except you go to the rural and you won't go there.
Yes.
You are here with us. So please stop ordering malaria drugs from Nigeria, wasting money and also hurting yourselves. Please, you've heard it from here. Okay, Abraham Peters is saying, thanks a lot, doctor. Please, what is the time difference between the first COVID vaccine dose and the second dose?
So right now it's if I'm not mistaken, 21 days.
Okay.
3 weeks, 21 days. So from the day you go to collect it, you can count 21 days.
Okay. All right. So we've been hitting all the points. Like, guys, big ups Dr. Marthilda in the comment section. Guys, she's killing it, giving us advice that you better take it. Okay, I want to ask you something a bit fun, something light. Okay. Can you share one crazy hospital experience you had? Like you came back and you're like, are you sure this medical thing is for me? One crazy, maybe in school or now practicing.
Oh, I have one.
Okay.
I have one.
Okay.
That fateful day. Now my English is for that fateful day. That day, I was the one on call. Yes, okay. We're having calls then, and it was the emergency department, ER. So I was the one on call from midnight till 3 a.m. when I was supposed to change with someone and go to sleep. A patient walks in and she sees me, Turkish by the way, and then she's like, I must be in the wrong room. That's what she said. Yes.
The nerve though.
And then she walked out. I overheard her telling the security guy, I think I walked into the wrong room because I'm here to see the doctor. And then he's like, please take yourself and do a U-turn, go back to that doctor room, apologize, that is the doctor. And then she calls back and she's like, you are the doctor? I'm like, yeah. And then she's like, you are the doctor? I'm like, yes. She said, how will you be able to treat me? I said, if you just tell me what is wrong with you.
Oh my God.
And then that's where she just started laughing. I'm like, because I'm speaking Turkish to her. Yeah. And she's speaking Turkish back to me.
She's shocked.
And she's in shock. She doesn't even know what she's saying.
Oh my
and then she's
God.
like, okay, I have this ache here. I have that. I'm like, okay. Then I write her drugs. And then she's walking out and she's looking at me. Like, this just happened.
Oh my God.
So that was when I was like, well, it hurt at the beginning, but then it later became funny. You
just laugh
like
about
she was dazed. Like, you should have seen her face. She was dazed. And then I overheard her hearing the guard. She was like, she's so young. How is she the doctor? And he's like, yes, that's how it is here in our hospital. Like, he was
so proud. We are so proud of her, guys. We are so proud of her. Okay, we have so many comments. Oh my God. Okay. Shout out to Lisa, Rhoda. Hi, guys. Lisa is saying, let's talk about self-medication because I'm guilty. You have heard it, Lisa. Do not self-medicate. Please go to her family center and get the right information. Lisa is saying a friend of mine had a dislocation and he was asked to run a full test in one of the hospitals here in Turkey before they prescribed ordinary painkillers. So you can imagine the money spent. So don't blame us if we self-medicate. So she's giving a reason why people self-medicate.
Yes. But like I said, now that you know that there's a free place you can come for free medical consultation, there's no need to go spend all that money. You can come to the clinic and then I attend to you. I see what's wrong. I don't need to,
Yeah, and the thing about, honestly, the thing about doctors checking, especially abroad, they want to be sure. Because some
Yes.
people, I know one lady in Germany was complaining that her child was sick and they refused to give paracetamol. They kept giving her herbal teas to calm the fever first before giving paracetamol, because we as Africans, a lot of us believe we feel like Panadol is sweet. Headache, Panadol, this pain, Panadol, and some even go to the point of ibuprofen and
Yes.
other, so we feel like it's just we take it like it's sweet. So you
Yes.
should buttress on that, please, like the way
Okay.
we use Panadol and painkillers.
Actually, the thing you talked about, Germany, I heard the same thing, but that's actually their manner of approach in medicine over there.
Oh.
So they first try to calm the person down before they give other medications. So, but in Turkey, it's not really that way. The healthcare system is more tethered to what would kind of please the patient, I would say.
I'm so sorry, guys. We actually have a call.
Okay.
Today is a very good day. Oh,
Okay.
let's try to call her back. Oh, she actually called.
Okay, so back to what I was saying. In Turkey, medicine is practiced a little bit differently. It's more tethered to patient satisfaction more than the medicine in quote, but I wouldn't go into that. So, like if a patient is complaining of pain, what we do here is we try to get rid of the pain. So, the first thing, depending on the pain.
Sorry to interrupt you.
Okay.
Hello, good evening. Hi, can you hear us? Good evening.
Hello.
Good evening, ma'am.
Good evening. Hi, welcome to Youth Arise Chatline.
Oh,
She says that.
Can you hear us?
hello.
Yes, we can hear you now.
Yes.
If her network is back, can she type us the question
Yeah, I
instead?
think that's what we would do.
Okay.
Okay, so you could round up on what you were saying.
Yes, so I said
Yes,
it's...
I can hear you.
Oh,
Okay, welcome back. Okay, you want to talk to the doctor, right? Oh, we lost her.
We lost
I'm
her.
so sorry.
The network is actually bad today.
Yeah.
So it depends on what causes the pain. So we tailor the treatment according to what caused the pain and where the pain is located. So for example, if it's a tooth pain, it's more likely that there's an infection. So it wouldn't just be painkiller, it would be painkillers and antibiotics for that. And then you refer the person to a dentist to get it checked. So do not self-medicate, I would say again. You actually don't know. It could be lesser than you think, and there could be more than you think.
Okay. All right. Adeleke Bukola is saying, how about us that believe Nigeria M&B paracetamol is better than the Turkish parole? Then the pecan for babies for teething, because Turkish hospital believe teething is normal. It's a normal process a child should go through, and it doesn't need any drug.
True. You do not actually, the pecan for a teething child is the wrong thing. If they actually follow other doctors on Instagram and other places, they follow pediatricians, for example. Pediatricians are children doctors. You would see that they advise against pecan. They will tell you, oh, the child is teething, let the child teeth. If there's fever, you give paracetamol. Of course, baby paracetamol. So what else do you want? The child is teething, it's going to teeth, it's going to go through it, that's how it's going to eat food. So there's nothing else actually, except it gets infected. Like I said, then antibiotics come into the play. But why are you giving that? It's more harmful for the child. And that's why some children, constantly get stomach aches and stomach problems. Why? Because when they actually now start to eat, the antibiotics that have been given previously have killed so many good bacteria in their stomach, so they are always reacting to food. So mothers, please help me on this.
Please. Then this one, it says about the paracetamol being better than the Turkish parole. I don't want to say anything. Please just speak.
The thing is, different drugs, different brands. There are different brands. Not everything is going to work for you. There's one called Minoset. There's one called Paro. Sometimes Paro doesn't work.
There's
It's Minosent.
Panadol, right? That you can.
No, that's aspirin.
Okay.
Actually, Panadol is more of aspirin. So we don't really advise that. Why? Aspirin doesn't allow your blood to clot. So when you get a little injury, you bleed more than you should. So aspirin is not something you should just abuse, because God forbid the person has an accident. Then people wonder, why can't they stop the bleeding? Because the person is taking aspirin, they should not be taking. Wow. So this is why I said do not self-medicate. The most innocent drug you can ever take is paracetamol, and that even has its limits. Some people abuse it, and paracetamol toxicity is very harmful to the liver. It shuts down the liver, honestly. So be very careful how you also take paracetamol.
Oh my God, there's so many comments. Okay, let's quickly go through. Adeleke saying we are proud of you, we're proud of you, our doctor.
Thank you.
Someone is saying having a medical insurance can help reduce the cost of medical bills. Is that available in Turkey? Medical insurance?
Yes, medical insurance available, but it depends on the type you have. There are some with wide coverages and there are some with lesser coverages. So if you get the one with the wider coverage, it will cover your drugs. For example,
this information, is it available in the family center? If you come, can we get more information about the insurance?
I can actually tell you about the insurance companies, but it's left for you to choose to call them. There are some that are actually good. Like I think Anadolu Sigorta is very good. They can be expensive when they are all inclusive, but it's good. But the best insurance you can ever have in Turkey is the Turkish government insurance. The trick, however, is when you just migrate from Nigeria or wherever. That is when you get your first resident permit is when you should actually go and get it. After a while, you can't. There's a time limit. Like it's like when you come into the country, there's a time ticking. And not only that, the other challenge, not a disadvantage, is you have to pay every month when you're a foreigner. I think you have to pay almost 900 Turkish lira every month to stay insured. So that is the challenge. But if you do not want to spend all that money, there's private insurance. Anadolu Sigorta, for example, covers a lot of things.
Okay. All right. Lisa is saying, true sir, I don't know how that works. So Lisa, you can contact her to hear more about the insurance policies that exist. Best known is saying, please let the doctor continue. We are listening. You are gonna pay. You are going to pay for more sessions. Thank you so much. We are really humbled to have you. There is so much to talk about.
There are so many questions.
Oh my God! Hold on. Oh.
We can take a few more.
Yeah, let's see.
And then call it a day.
Okay, so when it's also I celebrate you. Ibukun Oluwa is saying we celebrate you, Doctor. Princess is also saying, what if you just feel headache? Can't you just take Panadol?
If you feel headaches, of course you can take paracetamol to alleviate yourself, or Panadol. Just one will not hurt you. That one is not saying that. If you have continuous headaches, however, you need to go and get that checked, because some people have headaches for a long time, and there is a reason why you are having headaches constantly. Your brain is actually communicating something to you. It's complaining there's something. Either you're very stressed. Or there's something actually off in your body and it's giving you signs. And God forbid, it depends on the age of the person. It could be alerting you like a stroke is coming. And worst of all, there could be a tumor growing in the person's head. Wow. So this is how it is like. It can go from 0 to 100.
Okay, thank you so much. So many things to talk about. I'll ask one last question. So talking about menstrual, we can't go. Women's health will be on its own. We dedicate one special day to women's health. So, but let's also talk about. We're talking about painkillers and aspirins. The menstrual pains. So a lot of people take aspirins, ibuprofen.
Aspirin is not really advised for menstrual pain because it does not have any effect on the womb. The womb is a muscle, so aspirin does not really have effect on the womb. So what aspirin will actually make the person bleed more. Like I said, aspirin is a blood thinner, so the person would bleed more.
Guys,
so people
you have to
who
share
take
this
aspirin
video
during their periods, they notice that they have themselves
Heavy
soaked
flow.
they have heavy flow. It's the aspirin. So stay away from that. Take drugs like ibuprofen. Like in Turkey, they have one called Majezik. There is
Yes.
another one,
Advil.
Aveles.
I think there's one Advil too.
Yes, those ones you can take. They are ibuprofen. What they do is they go and they even help you reduce your blood flow. So they don't allow you,
Yeah.
to lose so much blood. So they help you. What we advise actually is, if you know, you should always calculate your cycle as a woman. You
Yes.
should know when your period will come. So you should start taking this drug, one, maybe just one on full tummy, that's after eating, one
Very
once
cool.
a day, once a day,
Mm.
2 or 3 days before your period comes, so that you have an easy period.
Easy flow.
You have to prevent yourself from having the pain.
The pain.
Yes.
Not on that day.
Not on that day. It's already
I'm on
it's
that
late.
table, yes.
It's late. So you start earlier
Okay.
and make it relaxed, because what actually causes you pain is the contractions. It's contracting.
I'm just learning. Like,
yes, that's it.
wow. We need to, guys. We need to have her here again. But you guys are gonna pay. I'm serious. This is so much information. So
Yeah.
much information. Thank you so much. Thank you so
You're
much. We
welcome.
are so grateful to have you. I am honored first to have you, to be the one talking to you directly. I'm so honored. Thank you
Thank you for
so
having me.
much. Thank you. So any final words? You want to say anything to them?
Okay, I would like to say, everybody, please take care of your health out there, because if you're not healthy, you cannot really do anything. We all know when we are ill, we know even our businesses we are running, we cannot run them properly. So endeavor to get yourself checked at least twice a year. That's every 6 months. Go and see your doctor. You don't have to be sick to come and see us. You can just come and see us to make sure everything is running smoothly. It's just like your car. If you have a car, you shouldn't always wait until the engine knocks before you go to the mechanic. You should always go and take your car for servicing before it disappoints you on the road.
It will not disappoint you, Jesus' name.
Amen.
All right, thank you so much, darling. Let's quickly just go into 1 or 2 reminders. So the person who called actually sent a message.
Okay.
She said, though I do not have a question, just want to show appreciation to the speaker for the wonderful health talk. I was calling from Nigeria. And also, I want to use this opportunity to wish Mr. Pius Emmanuel a happy birthday in advance. He's one of the Chatline members.
Okay.
Mr. Pius, happy
Mr. Pius,
birthday
happy
in
birthday in
advance.
advance.
Okay. So also we have some announcements. Okay, and I'm going to be saying them quickly. If you are living in Istanbul, Turkey, and you are privileged to be in SNU, please, we're inviting you to our student welcome service, where we're going to be welcoming all new students from all over Istanbul, okay? They're registered for the September session. Please come and have your service with us, and we'll have a lot of gifts and amazing things to share with you. You should make it a date with us. Like, from this show, you should know what we can give you. Guys, come. All right. Also, the first of its kind, okay? The first drama night in Istanbul, Turkey. And the theme is that faithful and true. Guys, come and not just watch and be entertained. Come and be blessed. Come and renew your covenant with God through ministrations. There's going to be so much on that. It's on Friday, 15th October, 6 p.m. here in Abjila, RCCG NLA. Also, the student service is going to be happening on Sunday the 17th. So after the Friday drama on Sunday, we're going to gather here to worship with the young. Sorry, not really young, the new students, okay? So we can't wait to see you guys. Please come. And if up until now you have not subscribed to our YouTube channel, are you joking? With all of this, Dr. Marthilda is coming back, and you want to hear the story? Don't do that to yourself. Please subscribe to our YouTube channel. Follow us on Instagram, on Youth Arise Chatline, and also on Facebook. Leave your comments, share with your friends. Come on, guys, like, there's so many things I myself never. Guys, we pop these pills every day and they're actually harming us. So please share this with your loved ones and your friends. Leave comments and make sure you subscribe. Hit the subscribe button and follow us. And from us here in Istanbul, Turkey, Youth Arise Chatline, Dr. Marthilda, I can't say thank you enough.
You're welcome.
Not just for what you've done today, but for showing us that tenacity, courage. You are the true definition of an African woman. Like, you've pushed so hard for years, and we're not just learning about the medical aspect, we're seeing your journey and seeing the fruits of your labor coming to you right now, and seeing that you didn't just succeed, you're not helping other people, you're helping us, and we're so grateful. We're so,
You're welcome.
God, thank you for her, and we're so blessed. Shout out to your husband, your family, your practice. We are so honored. And guys, until next time, I know you can't wait for her to come back, okay? So until next time on the show, my name is Chedi Uzo Igwe, and she is
Dr. Marthilda signing off.
all right. Bye.
Bye bye.